You studied the prognostic impact of FDG PET-CT parameters in primary mediastinal large B-cell lymphomas. Why is there a need for better prognostic models in this disease?
This disease has an excellent prognosis, with more than 90% of patients expected to be disease-free and alive at 5 years or more after therapy. However, for the few failing the initial standard immunochemotherapy approach, salvage treatment is particularly unsatisfactory and disappointing, and the outcome for relapsing patients is worse than for the rest of aggressive lymphomas. So we need reliable prognostic indicator to understand early who is going to fail standard therapy and might need more intensive risk-adapted strategies.
Which parameters did you study and in how many patients, and how was the study conducted?
The study was aimed at prospectively evaluate the role of PET, both addressing the visual analysis of the PET scans and the quantitative analysis of the main PET-derived parameters, which are the total metabolic volume, the total lesion glycolysis, and the SUV max. In addition to those parameters, we also studied their changes during the therapy.
And how many patients were included in this study?
120 patients were enrolled. For the present analysis, we have 100 patients who had baseline and end of therapy PET, which have been actually studied in this quantitative parameters analysis.
And how was the study conducted?
The study was conducted in several centers, mainly in UK and Italy, but also in Switzerland and Spain. And PET analysis for the study was done centrally with a blinded reviewer, which was an expert nuclear medicine doctor, and he was blind to the clinical information.
Which parameters or combinations of factors gave a good prediction of the progression-free survival?
Individually, all the studied parameters, tumor metabolic volume, lesion glycolysis, and SUVmax were associated with the outcome. But the best individual predictor is the total lesion glycolysis, which is somehow the product of the tumor volume and the PET uptake. And this parameter was very good in predicting the long-term outcome, either when measured at baseline and post-immunochemotherapy. The combination of this parameter with the visual analysis using the Deauville scale, 5-point scale criteria, is the best way to separate patients with poor risk from the other.
Are you planning further studies for prognostic models, and what are the next steps in this line of research?
Well, we are keeping the analysis of this set of data from the PET studies in the ILG 26 trial, and we are now checking if there is a correlation between the interim PET, which was actually done only in a relatively smaller subset of patients, with the end of immunotherapy PET, because potentially combining the visual analysis at interim PET together with the baseline total lesion glycolysis might provide an early predictor of outcome that you can use to build up risk stratified treatment strategies.